Good morning or good afternoon, depending where you are. My name is Aliu. I am recording this video to share my finding about COVID-19. This is December 2024. Today is the 23rd, I believe. And I'm just doing this part to share a fundamental finding about COVID-19. My background is I'm a biologist. I'm originally from Senegal. So let's see. I'm using this globe here to just do my my demonstration, and also I'm gonna use this globe to explain how I did my finding. This board, and for any scientists, I will also need to give couple illustration about what I find out about COVID-19. And I'm recording this video because this can help us do a lot. So for that, let's go back to what we have. We all remember in 2019, end of 2019, we have the COVID-19. We all watched what happened in Italy, in Europe, and US and everybody. And the United Nations predicted it's going to be the worst case in Africa, right? But it does not happen. And I want to explain why, okay? I want to explain why. Why, whatever prediction, whatever modeling they have, because before you make that there is a modeling, the model did not work. And I believe I will be able to explain it. So, without any background in science, there is like basic approach we can do. In Europe, the virus was able to move from one person to another one. And whatever enabling that has to be really present there, okay? And in Africa, the same enabler, if you have it here, it should be, let's say, less present, without even being a scientist. The virus moved from one person to another one, let's say 20 times, because when we look at the statistics, that's what will happen. So basically what we have is COVID-19 is a flu, right? So basically the modeling we most likely use is, let's say you have the flu, you emit like aerosol particles, okay? Because by sneezing, coughing, And also, in the other hand, we have hand contamination. We know, you wipe your nose and everything. But we took this this one like the main vector, and I believe this is where we make a mistake. And I will show you it's easy to understand because it's difficult. I get the point why the scientists go, because this is easy to explain the speed the virus was moving, okay? But we'll see. But the thing is, we have hand can have the liquid and they can spread the virus too. So if you have two routes of contamination, you should know the size. Which one is bigger? Which one is lower? Are they equal? Okay. So that's why I use a very similar virus here, HIV virus. Like we know this one, right? HIV virus. We know we have blood-to-blood contamination, okay? But in the other hand, we have STD contamination, sexual transmitted disease, right? But both, you can have the virus, right? HIV virus, but what is the size, okay? And I strongly believe the STD is way more frequent than the blood-to-blood transmission, right? Because if you don't use condom, you know what happened, right? So both can spread the virus, but since we have two routes, we need to know the size, and it's exactly what happened with coronavirus. We didn't. I never heard about anybody telling, what is the size between hand contamination and aerosol contamination. Okay. So So it's easy. Since we didn't answer it, I just have to redo it. Okay, we redo it. So basically, we know the output, right, by testing, but the input is still a mystery. Okay. So I will redo the same things by going simple here, right? In biology, anybody should know a virus is a parasite, right? And a parasite always has a host, and we are the host. So using the term virus is somehow wrong. You will not able to really get the biology itself, because the virus is not the one is moving, it's the host. And that's why I'm using the one we already know, the malaria, right? We know the mosquito is the vector, but the disease is the Plasmodium falciparum. But we talk about the how it's called, the host rather than the disease itself. Okay. So I'm just starting another recording because it just fell. So basically, what I've done by redoing the modeling, right, is to remember a virus is a parasite, we are the host, human, and by analogy, we can use the same with mosquito and Plasmodium falciparum. Okay, so let's say here, it's easy. You have the aerosol particle. We talk about wearing a mask and social distancing, but it did not work because we remember it did not work for Africa. And why? And my modeling, I'm just going to focus on runny nose. You have the liquid form, the hand, go to the hands, the hand becomes a vector, and you go door handle. I believe this is my main things. And I use a simple model here, right? I'm just using this one here, okay? This is a perfume, right? So we have sneezing, right, going. You can see it. But here we have particles in the air, and anybody can smell it. And I don't know why children didn't get the virus. And the liquid form, when you have the runny nose, is this part. So this is more concentrated, but in the case we are studying, we don't have alcohol inside. It's just a liquid form. So the virus have more chance to be living in the liquid rather than being a particle. And biologists, we know exactly that the liquid form have more chance to be living. And we know virus cannot live outside the cell. We know that. And this is by definition. But I'm not going to go all the way about the science things, but we know that, okay? So for me, and this is where I was lucky, I believe the hand contamination is the key of everything here. And for that, it's easy. I just want to show you something here. Let's share first what we have. I came from this city in Dakar, from Senegal. So I am originally from here. So it's very good to use the globe here. We're going to use it because it's a pandemic we want to talk about. I'm originally from here, it's 15 degree. And I'm now living here in Alberta, 60 degree. And I can see my daily activity here versus my daily activity here. And you know what I found out? In Africa, let's just show you this one. This is an area where I came from, if you look, because seeing things are the same. Look at here. These doors, look at this one here. I'm just using Google Earth here. These people are just doing the daily activity. Look at here. I just want you to focus on the doors. Look at the doors here. If you are not born in this environment, look at this business here. I'm not sure if you guys have, but look, the doors are always open. Look at this shop here. You see the two doors open. Okay, more you go, this is where I came from. You see the house, the door open. So basically what I found out is We in Africa, we always, let's use another Google Earth. This is an area where I know very well. If you go, look at here. This shop here, okay? You see, this door is open, right? All day long until they're gonna close. They can close when they go for lunch. Look at this door, and this lady selling. Okay, basically, look at here. These guys are sitting, and this door is open. We basically don't open door in Africa. How I can make it? Let's say during daily activities, we don't look at this shop. This is a typical example. You see, these two doors are open. People get in, and they don't touch any door handle. Okay. And what I find, I'm gonna use my house. Yeah. This is, let's do it. I have to get out, and I will show you something. The main difference is here. Amazon Prime. So in Canada, we know that. So those who don't live in this, look at here. When I come to my house, I do this. You see my hands, where it's going? I do this, I get in, but you can hear the door lock by itself. We always have this in the cold climate, right? The door closed. So we have 1, 2, 3, 4 door handle, 2 to get in, and always focus on this one. And it can lock. So basically what we have is in Canada, cold climate, we always have this door closing all the time. So, and how I gonna make it easy? And for reference, Professor DJ Raoult, during an interview with Canal News, he said the hand contamination is the key, but no one listened to him. He was right. 2 months, I found this one. 2 months after, he said, hey, hand contamination. I don't have the link, but he did it with Canal News, part of Canal Plus. Basically, in summary, in cold climate, we have a normally closed door all the time. In hot climate, we have a normally open doors. So he's cold, and this is hot climate. So when you go back here, the enabler is the door handle, very present, and here is absent, or very or very few area you're gonna have it. So this is gonna be the second video where I will tackle another issue: why some group are more likely to have COVID than others. I didn't get it, It's we know the statistic in the US. Let's do it this way. We know in the US, UK, then Canada, when they run the statistic, black people are more likely to have COVID than as a community. Why? I never get it. It does not make sense. Like, here we have black people less infected with COVID. We know that. This is the output, right? We know this is when they test, it show here we have very low, 20 times less. But when you are black, you live here, or Canada or US, you're most likely to have COVID than other people. I never get it until I watch this video. Then let's go check this one here. I never get it until I watch this one.
A block party for our times. In Toronto's COVID hot zone, where black people are the largest population group and infection rates are high, people are encouraged to come out of their apartments to get tested.
It decreases that anxiety. It helps people feel comfortable.
There's good reason to be anxious. Data from the U.S. show visible minorities are more likely to test positive for COVID-19 than white Americans. No such research is available for Canada, so visible minorities don't know their risk level. But data from Toronto Public Health is revealing. Less than 10% of Toronto identifies as black, yet they represent 22% of cases, while whites, who make up almost half the city, account for 17% of cases.
What is less clear in the Canadian context is why.
This infectious disease doctor plans to find out with widespread antibody blood testing in Ontario's black communities to learn who's already been exposed to the virus and discover who's most susceptible.
And how measures ought to be ramped up or directed at minimizing the risk of further outbreaks within certain communities based on the risk factors that we identify.
But finding black volunteers to give blood for science could be difficult. So says this local leader. There are several...
So I'm just going to stop it here. And when I watch this video, you know what I find out? It's this image. This is where I get it. You know, when I look at this building behind, I said, yes, it makes sense. They can even locate them. Let's see. What happened is, it's unbelievable. It's like I said, we are the hosts. Any explanation has to be simple, right? You don't need to be a scientist. You don't need to be smart, and even don't try to be smart, because you don't need it. It's simple. I never get it, right? It doesn't make sense. It's easy. This is a workplace. This is a store. This is a public area. People, it's very difficult to have in this kind of environment. Let's say the workplace, you have a manager and a cleaner. They're all going to be in the same environment. They're going to touch the same door, you know. It's very difficult in this environment to differentiate. This is a store. You have rich or poor people, whatever you have. White and black and Asian, we mix here and we do our shopping. Workplace, same thing. And until I see that video, I said, no, the difference is when we go home. Going home to a house is different to going home to an apartment building. Completely different. Yes, it's not the same. We human, we have just two types of habitat. A horizontal habitat here, habitat where we have houses next to houses, right? And a vertical habitat. So in the vertical habitat, we basically stacking these houses vertically, and let's say you have 400 houses, you're going to have 400 doors. Here you have 400 houses, we call them apartment, you're going to have one door entry, one main door entry. So we're changing the number of door from a big number, let's say number of houses equal number of door. Here number of houses, whatever number of apartment like the building we see, it just, let's say one door entry to make it simple. It's not the same. Let's say you have a couple. Let's say each apartment has one adult. So you're going to have here a community of 800 people, right? And here you're going to have another community of 800, right? And you have one in this first house, you have one infected here, one infected with COVID. So this one adult will able to infect just one adult. And we know, right, when you have the virus between the 48 and 72 hours, when you get infected, that's where you become like very, very bad. Like you can transmit very bad, because in biology, we know that the virus going to try to be viral, right? So when it gets into your system, the first thing he makes sure you pass it to another person. This 48, let's say it's 2 to 3 days. What will happen? This adult here in the house, he go to work, right? He touch the door, he go. He can infect the adult. He came to work, he touched the door. So in the day, he gonna be He has two chance. Oh, okay, just resume the video. So here he has two chance, and for 3 days he's going to have 6 chance, right? And for an adult here, an infected adult, you will have one person has a potential to infect 799, right? Going to work. So he's leaving the building, he's going to work. And when he came back, they say all the 800 go, he came back, he's going to touch. Usually the building, you have 2-door entry and a door elevator button, right? So he going, if you have a runny nose, that's my main thing. The runny nose is sneezing, but focus on the runny nose. The hand contamination, he will leave it there. He will leave it there and has a potential of 7. So you can see in the day he has 1,590 chance to infect. Like the probability is very high because remember, we stack people and give them just 1-door entry. Okay, in 3 days, look at here, 4,794 chance. Okay, so here easily you're gonna have a cluster. Think about now, this person here, one of them is a manager, and here, let's say it's a workplace, you have a manager and a cleaner. So when they go home, who gonna go in a house and who gonna go in an apartment building? We know that the cleaner was likely gonna go here and the manager gonna go to a house, right? Because he has more money, so he's gonna afford to have a house. So we can see easily that living in a vertical houses, you are more likely to touch a door handle, right? And to get the virus easily. And here you're gonna even easy to have a cluster, okay? And they're gonna shut down the building, right? It happened. So why people are different? It's just in the habitat we chose, okay? And when we came back to this video, it was just this picture that tell me, yes, it's this building, okay? Because we know that, right? Okay, I will try to wrap the video here, and in the next video, I will try to tackle another one, and it's gonna be always in the same the rope I have, like hand contamination, the liquid, and always have this idea of let's say here, the nose when you sneeze, the liquid form, and like the aerosol particle and the liquid. This is my modeling. So when you have this liquid given to your hand, you have more concentration, okay? That's my main thing. And we'll see why children are less affected. Hey, this is me again. So we're gonna do this last, not the last video, but the last thing we found out with COVID-19. We know that children in general are less affected, okay? Children in general are less affected, but I didn't get it until I think it was December. It was December 10, 15. I was watching the global news. I don't have the link because I don't have it anymore. I never save it. And there was a baby who had COVID, right? A baby who have COVID. And my first question, I said, and they make the news, right? Do children open doors? It was no. But in this news, he doesn't just say children didn't, children doesn't have COVID, but he said the age, right? The younger they are, right, the less likely they're gonna test COVID, test for have COVID? And I just say yes, it makes sense. Here is a group, right, who is in a community, but somehow the virus avoids them. And we're gonna come back to here. It's not about the virus, it's about us. And it's unbelievably simple. And let's go back to my, so what we know. So when we have babies, it's gonna take 1 year here. Maybe start standing and walking, and and they're gonna grow. I'm just gonna go there and show you again. Here, what we have, just turn on the light here, it's a little bit dark. So what we have, it's easy. This door handle are fixed like element, like they just swing back and forth, they don't move. So if this is where people getting the virus, in order for the children to have the virus, he need to open it. And we know that a baby doesn't have the height, it doesn't have the muscle or the brain. So this baby, until they're going to standing, they have no contact for a door handle. And this group is less likely to have COVID. Very interesting, right? And we know more, then they're going to start standing, they're going to start walking. And after, they're going to explore the house. But we don't see a 2 years old opening a door, right? That's what I call height, muscle, and brain. In order to deal with door entry, you need to have the height, the muscle to pull or push the door, and the brain to be able to do like an adult. So the variable here is a baby. And sometimes we forget, but we human are really special species. That's why I call it the wildebeest mama. The wildebeest mama, when they have a baby, right, in the wildlife, they start walking within minutes. We human, it takes us at least 1 year to start walking. And then we don't have a 2 years old going out, right? So we don't see children dealing with door, okay? And the variable here is the human offspring in regard to door. So if the door entry is where mainly the infection happen, it makes more sense because we know here we all are certain that a sitting, crawling baby have no access to that door. It gives more proof that the door entry are where most likely all the infection is happening. And I'm going to share another thing here. I use the term height, muscle, and brain. It makes sense, right? You can have the height, but you don't have enough force to open the door. 1 year or 2 years, we're not able to open the door, right? And when even they can open the door, they are not. Even when they have the muscle, they don't have the brain. We don't let them go out. They don't have a key. They cannot open the door. So we are certain for what I call the lower limit. The lower limit mean a baby. We are certain there are no contact. My question, I don't know, right? What is the upper limit? Upper limit. I just see on the government side that they use 11 years, but not 12. 11 years. I wasn't able to find it. There should be an age where children are given a key for the house. A key for the house, they're going to start acting like an adult, and they will able, there should be a split between that age where children will able to basically do like adult. Okay, so this is, I believe the door handle is way more important, right, than the aerosol, because you can see it explain all what we're seeing. Hey, this is gonna be the fourth and last video. I'm just gonna try to summarize things here, okay? What I've done on this video is try to find out how the virus circulate, okay? And if this is true, that show exactly why we fail to control it, because we focus more on social distancing and wearing a mask. This can be true, but it's very tiny, okay? So all the three topics I have tackled, they are all related. Basically, when we come back here, if you follow what we have here is adaptation of human being, okay? Anybody living in this equatorial region, right, does not need to deal with the variation of temperature, basically. You don't need to deal with the variation in temperature. But more you go to higher latitude, temperature dictate how we live. And basically, what we find is here, the door are normally closed, so the hand need to be used to get in and out. And here, like I showed we don't need that. That was my first finding. Basically, the no use of door versus always using a door can easily explain why the virus was spreading Europe, Canada, and US and Canada, okay? So at the same time, the same door, okay, we can see when you're living in the cold climate, when you're living in a vertical habitat, so the overuse of a door can easily explain why the virus was able to segregate. It's not the virus segregating, we give it the opportunity to spread by using several houses for one doors, okay? So we give the virus opportunity, but the virus itself cannot do it. Like when we go back, it's about always us, the host, because moving from a parasite, right, a virus, using a word parasite, make it easy. You don't even need any other tool. You just need human biology, human ecology. So I was able to explain that. And we have the overuse of door handle with vertical and no use because the children does not interact with door. We don't build houses using the height of children because we know they grow. So you can see all these three elements are interconnected and it makes more sense. And in some area, I was tackling why South Africa have more COVID than more than other countries. But I think now the point is clear, right? We don't need that. And basically, I was lucky to be born here, study biology, and now live here. That's what enabled me to see what a lot of people cannot see. And this is important here. If this is proven, right, that it is proven that the hand contamination is more important and is the main vector here, we can fix two things by saving lives. We will able to control COVID-19, but we will able also to control the seasonal flu. We will able to reduce very good the number of contaminated people and save a lot of lives. So This is important. We need to check it, right? This is just like general idea I've given, but it just explains the output, what we are seeing. But I expose the input I just given with these three situations, explain exactly what we are seeing. So we can reduce we can save lives if this is proven. By just we know how to make sure to make sure this contact doesn't happen, or we can reduce it very, and we'll able even a regular with a regular flu, we'll able to control it. Okay, that's my best I can do. Thank you, and have a good day.